This is Jumpstart Week 4, Healthcare. When we talk about the Healthcare Information System, most people think about the Electronic Health Records, or EHR. But in fact, there are many different types of systems, including the EHR, barcode med administration, computerized provider order entry, or CPOE, electronic prescribing, ePrescribe, clinical documentation, radiology systems, ancillary systems, and many more. This week we'll be talking about security, information system, and informatic tools to promote safety, patient safety. So when you think about the words privacy, confidentiality, and security, what actually comes to mind? More than 600,000 Facebook accounts are compromised every day. Medical and healthcare has almost 40% of data breaches, and 1.5 million victims of cyber crime are committed every day. So, as you may have heard recently on the news, some healthcare records were hijacked for a ransom in Hollywood at the Hollywood Presbyterian Medical Center, in which they had to pay the hijackers in bitcoins. So at the hospital where I work at, they block inbound emails in a 24-hour period. Shows on the screen that there was 76,000 total clean messages, but there was a total of almost 300,000 inbound email messages which were blocked. Of the 76,000 clean inbound messages, there will still be spam and malware contained in some messages that do not get filtered. This requires that all 10,000 users be trained not to click on links or open suspicious emails, even though some people do. One wrong click can result in a pink slip or expire a virus outbreak. Removing inbound email to even some of the 10,000 email users on our network can drastically reduce our risk. And when we ask the chief information officer what keeps her up at night, she goes, anything that she doesn't know keeps her up. There's just so many security risks that you may not even be aware of that can be a threat. A 2003 nationwide survey by the Computing Technology Industry Association found that human error was the most likely cause of problems with security breaches. The first line of defense is strictly physical. The power of locked door, an operating system that locks down after 5 minutes of inactivity, and regular security training are extremely effective. So, confidentiality is safeguarding all personal information by ensuring that access is limited only to those who are authorized. Shoulder surfing or even watching over someone's back as they work is still a major way that confidentiality is compromised. The most common threats a corporate network faces from the outside world are hackers, malicious code, which includes spyware, viruses, worms, Trojan horses, and the malicious insider. Spyware is normally controlled by limiting functions of the browser used to surf the internet. So what spyware is software that allows another user to track another computer use, whereas a virus is a code that can replicate itself and infect computer and destroy systems. Worms is a standalone malware program that replicates itself in order to spread to other computers. A Trojan horse is a computer program that may steal information or harm computer, which is non-replicating. And a malicious insider is a hacker that inflicts damage to a system. A cookie, even though it looks yum and delicious, and especially heated up in the microwave, is a small file written to a hard drive of a user surfing the internet. On the negative side, cookies can also follow the user's travel on the internet. Spying cookies related to marketing typically do not track keystones to steal user IDs and passwords. They mainly just track where you go on the internet. So security tools. There's a wide range of tools available to an organization to protect the organizational network and information. These tools can be either a software solution, such as an antivirus software, or a hardware tool, such as a proxy server. Email scanning software and antivirus software should never be turned off, and updates should be run weekly and ideally daily. Software is also available to scan instant messages and to automatically delete spam email. So there are different tools out there to authenticate users. Authentication of employees is used by organization in the security policy. Organizations authenticate by something the user knows, like a password, something the user has, like an ID badge, or something the user is, like biometrics, like a thumbprint. Policies typically include the enforcement of changing passwords every 30 or 60 days, biometric devices, including recognizing thumbprints and retinal scanner patterns or facial patterns. Organizations may also use a combination of these types of authentication. So when we look at some of the other security tools like antivirus, this is a computer program that is designed to recognize and neutralize computer viruses. Whereas a proxy server, which is a hardware security tool to help protect the organization against security breaches by preventing users from directly accessing the internet from corporate computers, issuing masks to protect the identity of a corporate employees accessing the World Wide Web, and tracking which employees are using which mask and directing the traffic appropriately. A firewall is also another example of a security tool. A firewall can be either hardware or software or a combination of both. A firewall can be set up to examine traffic to and from the network, so I always imagine a crossing guard. Firewalls are basically an electronic security guard or a crossing guard at the gate of the corporate network saying, yes, you can come in, or no, you can't. Then there's use of portable devices that are password protected. Could be a USB, otherwise known as a universal serial bus, which may be a trivia question coming up. VPN, which is a direct access with your computer to the network. Offsite uses of portable devices such as laptop, PDAs, and home computing systems, smartphones, and portable data storage devices can help to streamline the delivery of healthcare. Some agencies have developed a virtual private network, the VPN, that users must log in order to reach the network. The VPN ensures that all data transmitted via the gateway is encrypted. Only essential data for the job should be contained on the mobile device, and other non-clinical information, such as social security numbers, should never be carried outside the secure network. The agency is ultimately responsible for the integrity of the data contained on these devices, as required by the HITECH and HIPAA regulations. So, we'll discuss this online. A community hospital that was preparing for an upgrade, in which a nurse was in the pre-op, wanted to make sure that the history and physical was available for patients who came into surgery after an upgrade in case there was any kind of downtime with the computer. She wanted to put the patient files on her work computer, which was standalone work computer at her office. No one else had access to her computer. Discuss online if you think this is secure enough. The next topic is the electronic health record system. This is a data warehouse or repository of information regarding the health status of a client, replacing the former paper-based medical record. It is a systematic documentation of a client's health status and health care in a secure digital format, meaning that it can be processed, stored, transmitted, and accessed by authorized interdisciplinary professionals for the purpose of supporting efficient, high-quality healthcare across the client's healthcare continuum. So some of you may be able to recognize the old chart room, or may even have an old chart room at your hospital if you're not up on electronic health record system. But these were the days where nurses or healthcare technicians may go down and get the old patient's chart. So what is the electronic health record versus the electronic medical record? Well, the electronic medical record is just the paper chart from the MD office or hospital, whereas the electronic health record is the paper chart from both the MD office and the hospital. So in week 2, we talked about the American Recovery and Reinvestment Act, or the ARRA, ARRA. In 2009, again, I'll repeat it, the Health Information Technology for Economic and Clinical Health, the HITECH Act, was signed by President Obama, which gave financial incentive to hospital and providers who demonstrated meaningful use. So this is why it's coming up again, is because we're talking about the electronic health record and why it was such a push to get the electronic health record in hospitals up and running. And we also talked about meaningful use, governed by the ARRA in 2009, using the certified EHR to use information technology to increase the quality of care received and improve the safety of care that is provided by the organization. So we'll also go over the different stages. Where stage 1, meaningful use criteria focused on data capturing and sharing. Where stage 2 criteria advanced several clinical processes and promoted health information exchange and more patient-controlled data. And then stage 3 criteria focused on improved health outcomes for individuals, populations, and patient self-management tools. So let's talk about some of the components of the EHR. Some of the essential components of the EHR, as described by the Institute of Medicine in 2003, includes health information data, which is the patient data required to make sound clinical decisions, including demographics, medical and nursing diagnosis, medication list, allergies, and test results. Results management is the ability to manage results of all types electronically, including laboratory and radiology procedure reports, both current and historical. Order entry management, the ability for a clinician to enter medication and other care orders directly into a computer, including laboratory, microbiology, pathology, radiology, nursing, supply orders, ancillary services, and consults. Decision support is the computer reminders and alerts to improve diagnosis and care of the patient at the point of care. The electronic communication and connectivity is the online communication among healthcare team members, their care partners, and patients, including email, web messaging, and an integrated health record within and across settings, institutions, and telemedicine. Patient support is the patient education, self-monitoring tools, including interactive computer-based patient education and home telemonitoring and telehealth systems. Administrative processes are the electronic scheduling, billing, and claims management system, including electronic scheduling for patients and outpatient visit procedures, electronic insurance, eligibility validation, claim authorization and prior approval, identification of possible research study participant, and drug recall support. Reporting and population health management is the data collection tools to support public and private reporting requirements, including data represented in a standardized. When we look at EHR adoption, some of the types of information system are listed here, that we talked about before, which includes the CPOE, the electronic medication administration record, barcode med administration, e-prescribing, clinical documentation, ancillary service systems. And we'll talk about this later when we talk about patient safety. So some of the stakeholders that may be involved in the EHR are consumers, which would be your patients or any other consumers associated with the EHR, nurses, providers, organizations, insurance, and state and national governments. So think about, what are some of the benefits of the EHR? Some of it is the cost of owning that, less paper, access, being able to access the chart from home, from anywhere in the hospital. Also quality, safety, and efficiency. So some of the issues associated with EHR include costs, ownerships, data integrity, privacy and confidentiality, standards, and organizational cultures. The process of becoming a successful owner of an EHR has multiple steps and requires integrating the EHR into both organization day-to-day operations and long-term vision and the clinician's day-to-day practice. The first step of ownership is typically a vendor selection process. EHR certification ensures that the quality product will be selected. Selecting a system based on the organization's current and predicted needs. The criteria should include both subjective and objective items that will cover topics such as a common clinical workflow, decision support, reporting, usability, technical build, and the maintenance of the system. Implementation planning should occur concurrently with the selection process, particularly the assessment of the scope of the work, initial sequencing of the EHR components to be implemented, and so some of the differences between implementation versus upgrade. So implementation is the beginning to make use of a new project. So this is something brand new. It only happens once, and it's usually more costly because it's going usually from a paper system to an electronic system. Whereas an upgrade is going to the next version of the product. This can happen multiple times in a year. For instance, our institution, we do monthly upgrades just so that if there's new products or new enhances, we can push those out to our users. And also with an upgrade, there's usually less resources. You don't have to train as much as you would with the implementation. And also there isn't so much of a big bang theory. So some of the reasons to implement is because of the ARRA, or the American Recovery Reinvestment Act, meaningful use, transition from ICD-9 to ICD-10. This has improvement that we talked about earlier: safety, quality, satisfaction, and access. Here are some of the barriers to implementation, and I'll also be talking about how to help that. So getting started, sometimes people have a difficulty just even getting started. So it's useful to start off with setting a timetable. Not getting buy-in from staff. Make sure that you rely on a steering committee that can help push the agenda and help get people involved. Not getting enough training. Make sure you identify computer proficiency among team members. And also making sure that they attend training. Also, physicians or providers may be difficult. Make sure you involve them in the selection process and throughout the project. And also, you heard of implementation horror stories. So, in the vendor selection, make sure that you look at the product. Ask other hospital and offices if they use the product and what they thought. What are some benefits and disadvantages to using the vendor? Make sure you evaluate cost. Make sure you use some vendor assessment tools. There's many tools out there that you can find on the web. Assess what your needs are for the organization. Schedule site visits. Have the ability to integrate with other products. Especially with a EHR, if you're using some ancillary products, make sure that they have the ability to integrate other products. So here are some type of vendors that can be for the electronic health record system or for other kind of clinical decision support information systems. So there's Epic, Cerner, McKesson, Meditech, Siemens, and Allscripts. So some of the key stakeholders in the EHR would be your chief medical officer, a physician champion, a nurse champion, a project manager, a CEO. What other key stakeholders can you identify that might be helpful? So your implementation team includes trainers, testers, ancillary team members, subject matter experts, EHR builders, nurses, physicians. What are the importance of this diverse team? So when we talk about the system development life cycle, I think we may have touched on this earlier. When we implement anything, whether it's an EHR, any kind of other information system, we want to make sure that we have this development life cycle so it's not just stagnant. So we analyze and think about what we need. We plan, we develop the product, we test it out a lot. Sometimes we have to go back to develop if the testing plan fails. Then we implement, we maintain and evolve and evaluate what's going on. We return to analyze, and it's a continuous cycle. So it's important to note that you're not stuck on one that's always continuous, especially if you're implementing anything new or when you're going back to take a look at what's going on, or even for upgrades. This is very helpful. Some of the risk factors with implementing any kind of system is scope creep, which is when initial resources have budget for and when more enhancements you want to make than originally designed. There's financial risk factors. There could be resources, not having enough resources, software issues, also the big bang buy-in, whether or not you go up with the whole system or just parts of a system. So when we turn our attention over to patient safety, I wanted to share Emily's story. Emily was diagnosed with a yolk sac tumor when she was about a year and a half old. The tumor was the size of a grapefruit inside her tiny little abdomen. Even though Emily was diagnosed with this frightening form of cancer, her team of doctors and nurses assured the patient's family that Emily's cancer was not only treatable but highly curable. Emily endured months of surgeries, grueling testing, and rigorous chemotherapy sessions, which would last for 5 straight days. If Emily's blonde ringlets had not fallen out due to the chemotherapy, nobody would have been able to tell that she was even sick. She maintained her sweet disposition and contagious little giggle through all of her treatment. Emily loved to play dress up with her big sister Catherine, with all of their princess outfits. Nate, her big brother, would read to her for hours and hours the same books over and over. How Catherine and Nate adored their little sister. Emily's treatment had been so successful that her last MRI clearly showed that the tumor miraculously disappeared. In fact, 3 radiologists had to review the MRI films due to the fact that there wasn't even any residual scar tissue left. Emily's doctor said that if she'd never it was as if she'd never had cancer. Regardless, she was scheduled to begin their last chemotherapy session on her second birthday, February 24th, 2006. This treatment was to be sure that there was no traces of cancer left inside of her little body. We celebrated Emily's second birthday in the hospital. Some of her doctors and nurses had planned a surprise party for her and showered her with gifts, balloons, and the whole works. She had a constant flow of visitors to help her with her celebration. After Emily's grandparents left, Nate and Catherine came with their parents, bearing cupcakes for everyone on the floor. You could not think of a better birthday present than being told that this was Emily's last chemotherapy and she'd be coming home cancer-free. Emily would finally be able to live as a normal 2-year-old. Tragically, that never happened. On Sunday, February 26th, was Emily's 3rd day of her last chemotherapy. It started out as any typical morning in the hospital. Emily ate her breakfast while watching her favorite Barney episode as doctor and nurses made their morning rounds. Emily and her mom took a few laps around the floor with her IV equipment while she pedaled her big wheel with all of her might. After playing in the activity room and scrubbing the play kitchen set with the nurse's stash of alcohol swab, it was time for the lunch and afternoon nap. Emily's grandparents stopped by for a brief visit. That was the last time they ever saw their little Emily alive. Emily's fatal dose was administered at 4:30 Sunday afternoon. She woke up from her nap very groggily, which was so out of character for her. She kept trying to sit up and asked her mom to hold her in her lap. As she picked her up to cuddle with her, she noticed how the little body was so listless. She kept grabbing her head and moaning that it hurt. Emily spotted her mother's can of Coke that she had on the tray and begged to have a sip. She sipped the rest of the can through the straw in a matter of seconds. She cried for more before she started screaming, "Mommy, Mommy, my head hurts." The whole time she was screaming, she was holding the sides of her little head. Her mother frantically called for the nurse as Emily began profusely vomiting. The father walked in just as the nurses was grabbing her from her mother's arms. Emily went completely limp and the nurses began to resuscitate her. Within seconds, there was doctors and nurses everywhere. Emily was rushed to the intensive care unit as the team was urgently attempting to find out what they could possibly go so wrong. Within the hour, their precious daughter was on life support. Their parents held the little hand and ran alongside her bed as she rushed to have a CT scan and other tests to determine the extent to what damaged her brain. Since the life support machines could not go through the scanners, the nurses climbed on the bed and manually kept her breathing during the test. This was so real to have this happening and still no answers as to why Emily was dying. They couldn't be really happening. They should be having dinner with Nate and Catherine and on the phone to make sure that they had their books bag packed and ready for school. What were they going to tell Nate and Catherine? The last time they saw their little sister alive was on their birthday on February 24th. They were not allowed to visit on the weekend due to the cold and flu policy. No one had gotten any sleep that night. And after life support was removed on March 1st, she passed away. The family was completely destroyed by the preventable and tragic death of sweet little Emily. A pharmacy technician had been working for the hospital for quite a number of years, decided not to use the standard preparation bag of sodium chloride solution with less than 1% of clodium solution. Instead, the pharmacy technician filled a plastic bag with a concentrated sodium chloride solution of 23.4%, which she had compounded herself. When the pharmacy board investigated and other officials investigating Emily's death asked the technician why she had made this outrageous error, she replied that she did not know. She claimed that she knew that something was not right but was not sure. The pharmacy technician asked if she knew the overdose of the sodium chloride could result in death. She claimed she did not aware of the effect. How can a person who works in the pharmacy and compounds med daily not even know that? At the time of Emily's death, Ohio didn't even register pharmacy technicians. In fact, there wasn't even training or licensing required. And this started the Emily Jerry Foundation, in which they determined to make their nation and world-renowned medical facilities safer for everyone, beginning with babies and children. They're accomplishing this important objective by focusing on increasing public awareness of key patient safety-related issues and identifying technology and best practices that are proven to minimize the human error component of medicine. Through their ongoing efforts, the Emily Jerry Foundation is working hard to save lives every day. And you can Google this and find their story that's on the web and take a look. And this is why patient safety is such a big concern. So, patient safety. Nursing professionals have an ethical duty to ensure patient safety. Increasing demands on professionals in complex and fast-paced healthcare environments may cut corners or develop workarounds that deviate from accepted and expected practice protocols. These deviations are more than practiced in the interest of saving time or because the organization culture is such that risky behaviors are commonplace. Occasionally, these inappropriate actions or admission of appropriate action result in harm or significant risk of harm to patients. So you should be aware of some of the safety initiatives. So in 1999, the Institute of Medicine, the IOM report to Errors to Human. In 2009, they released the Quality CHASM report. And Agency for Healthcare Research and Quality, the AHRQ, launched initiatives focused on safety research for patients. 2002, Joint Commission National Patient Safety Goals. In 2002, the National Quality Forum Adverse Events and Never Events list, and created in 2004 was the Office of National Coordinator for Health IT to Computerized Health Care, and also in the same year as the World Health Organization Alliance for Patient Safety. Other campaigns is the Institute for Healthcare Improvement 100,000 Lives campaign, and 2008 5 Million Lives campaign. In 2005, the Congressional Authorization and Patient Safety Organizations, created by the Safety and Quality Improvement Act to promote blameless error reporting and shared learning. In 2008, No Pay for Errors Medicare initiatives, and 19 billion congressional appropriation to support electronic health record patient safety. So, having a safety culture is acknowledgement of the high-risk nature of organization activities and determination to achieve consistently safe operations, in which a blame-free environment where individuals are able to report errors or near misses without fear of reprimand or punishment, and encouragement of collaboration across ranks and discipline to seek solutions to patient safety problems, organizational commitment of resources to address safety concerns. So some of the issues could be alarm fatigue, in which medical equipment alarms frequently and inappropriate may be related to the sensitivity of alarm parameters. This could be alarms on IV So one of the issues could be alarm fatigue, in which medical equipment alarms frequently and inappropriate, which could be related to the sensitivity of the alarm parameters. And strategies to improve the alarm responses is improving the nurse call system by adding voice over internet protocol phones, and feeding alarm data into a reporting database for further analysis. So putting that information out there so that you can report on it. And then encouraging nurses to round with physicians to provide input into alarm parameters. So the most frequent safety issues talked about the National Patient Safety Foundation in 2013 is the wrong site surgery, hospital-acquired infections, falls, hospital readmissions, diagnostic error, and medication errors. Many of these issues can be prevented or early detected using informatics technologies. And technology integration into cycle reduces the potential for human errors by performing electronic checks, providing alerts to draw attention to potential errors, and tracks performance. We talked about CPOE a little bit earlier. So some of the benefits: prompts warn against the possibility of drug interaction, allergy, or overdose. It has accurate and current information that helps physicians or providers keep up with new drugs as they are introduced into the market. And drug-specific information that eliminates confusion among drug names that sound alike. Improved communication between physicians and pharmacists, and help reduce healthcare costs due to improved efficiency. So technology in the pharmacy, some of this does happen at our pharmacy, in which it can verify function is computer-based and the medication orders electronically checked via the knowledge database. So that's why it's such important to have pharmacy informatics involved. The system can do allergy verification, medication reconciliation with other drugs already in use. There's also barcode medication labeling, or RFID technology, which assists with dispensing and administration, and automated dispensing machines for storage, dispensing, controlling, and tracking. So also with barcode med administration, which we talked about earlier, provides a system of checks and balances to ensure medication safety. Nurses scan name badges, thus logging in as the person responsible for the medication administration. Then they scan the barcode on the patient's ID, prompting the electronic system to pull up the medication orders, and the barcode on each of the medication to be administered is scanned. This technology ensures the 5 rights of medication administration are done, which includes the right patient, the right med, the right dose, the right route, and the right time are met. Smart pump technology, this is something new and not all hospitals are using, but this is designed for safe administration of high hazardous drugs and to reduce adverse drug events during intravenous medication administration. Software is programmed to reflect the facility's infusion parameters and includes a drug library that compares normal dosing rates with those programmed into the pump. And discrepancies generate alarm, alerting the clinician to a safety issue. So the clinical decision support will help a clinician select the appropriate medication. It will ensure that the order is complete, checks for drug interaction, duplication, or allergy contraindications, the right dose, the right route. Provides double checks for interaction, allergies, and appropriate dose orders during verification and dispensing. Assists with infusion pump programming issues such as incompatibilities during infusion and proper notation and dispenses when portions of a dose. Assist with patient identification and current assessment parameters, i.e., blood pressure, glucose level, that may contraindicate the use of the medication at the point in time. Checks for interactions with foods and other medication, provides patient education guidelines and printable handouts. The monitoring function of the CDS provides a structured data reporting system to track side effects and adverse events across the population. So here are some of the technology for home medication compliance. The eMed Online collects patient medication compliance data by scanning package barcodes or RFID medication tags using a PDA or smartphone technology to send compliance data to the server. The SimPill medication adherence systems uses web-based technology to monitor patient compliance and provide reminders about taking medications or to refill prescriptions by sending text messages to the patient or caregivers. Again, the home medication compliance, they have caps of pill bottles that may contain RFID tags or radio frequency ID that monitor and collect data when the bottle is opened or contain flashing time reminders when the dose is due. Smart inhalers track asthma medication compliance using a microprocessor that records and stores medication compliance. So expanded radio frequency ID uses helps patient tracking during procedures and testing or function as part of the EHR communication, helps track medical supplies and equipment embedded into surgical supplies, and many more as listed on this slide. I like the smart room technology. If anybody, you can Google this and actually see this in action. When the employee walks into the room, it announces the patient on the monitor and also displays on the monitor who the person is and what they do. They can also review patient data in real time. So if a cardiologist walks into the room, then they can see information like a EKG and everything related to the heart up on the screen for them to view. So it's really an interesting technology that they're using today. So patient monitoring technology, there's body area networks or patient area networks provide the ability to wear a small monitor that collects and transmits physiological data. And we'll talk more about this kind of information when we get to this in closing. I really want to point out how important it is to have the electronic record for this and information system is to make sure that we have happy people and that patients are safe, that nobody has to die from a medical error. We want to ensure that the technology system are properly configured and maintained. Routinely monitor and check these systems while making sure that their human potential, the users, are capable of using the systems accurately to avoid errors. And nurses must be involved at all stages of the system development lifecycle. With a focus on safety, safety concerns and remedies need to be analyzed, synthesized, and integrated throughout to have a robust tool that provides meaningful information and enhances patient care while preventing errors and promoting patient safety.